Hi, I'm Dr. Melissa J. I'm a member of the Métis Nation of Alberta, the current Indigenous Director for the Canadian Counselling and Psychotherapy Association, or the CCPA, and I'm also a registered psychologist in Alberta.
I am Pisquisqueo Thunderbird Woman. My given name is Henry Giroux. I'm Woodland Cree from Driftball First Nations in Treaty 8. I'm a visitor here in Treaty 7.
My name is Dee Bremner, and I am an Indigenous psychotherapist in private practice in the city of Calgary.
So when CCCs in Alberta, Saskatchewan, Manitoba, Newfoundland, and Labrador were delisted from the NIHB program in 2015, this led to numerous disruptions of Inuit and First Nation people's mental health care.
You know, I share my story today because I know the struggles of mental health intimately. And I don't want my Indigenous brothers and sisters to have to strive to survive the way I have without access to a counselor.
Since CCCs were delisted, the number of NIHB providers have become limited in Alberta, and most importantly, there are very few who are Indigenous.
So in February of this past year, I submitted all of my paperwork to the NIHB program. And sadly, even though I implored that they make an exception for me, my request was denied.
So for NIHB, reinstating the CCCs nationwide will ensure that those reaching out have access to mental health care when they need it. It will also ensure that they have choice in who they see without having to navigate the healthcare system, which includes long wait times to see a counselor who is simply assigned to them. When it comes to government-funded care through NIHB, the most troubling part of the delisting of CCCs in all 4 provinces is that there's a vague written exception that notes CCCs can continue offering care through NIHB in unique and rural circumstances. That said, as we heard from my friend and colleague Dee in her video, this exception does not include Indigenous counselors with a CCC designation.